It's an exciting time for artificial intelligence in the operating room. I think we're beginning to explore and learn how we can use AI to make the experience for patients and staff better.
Sinai has a deep culture of digital innovation in AI. It started in 2015. It was very revolutionary for the time.
We have deployed over 20 machine learning use cases, ranging from deep learning, generative AI, agentic AI, and classical machine learning model across multiple hospitals.
AI tools can help us to better understand these really complex workflows that happen in the operating room so that we can better manage operations.
The potential for AI in the operating room is probably one of the greatest beneficial applications of artificial intelligence there is.
It's a long-standing tradition in surgery that surgeons look back at what they do. They look at their results, they see their outcomes, and they hopefully use that data to improve the future.
One of the problems that we have here at Mount Sinai is really having a full understanding of what happens for our surgical patients. What we would really like to do is get a larger picture of what happens for our patients from the time that they present until the time that they go home and that they're recovered. That's something that takes a lot of time, it takes a lot of effort.
It's just easier to identify those cases and separate them out and see how many times we get the consults as well. And
we decided to try to use AI to gather the data for us. And we've developed this tool that literally goes through all the charts in Mount Sinai on a weekly basis. And it pulls out the surgical patients, and it can identify those that have had complications.
And then once we actually submit it here, it would go to the surgical quality team for review.
Yeah, the strongest point is we had like 15 years of data, which we trained on. We trained our model on it, which is very specific, to Mount Sinai Hospital.
So we've named our tool Surge ENAI.
Surgeon AI is a tool that does two things. It filters for patients with surgical complications, and then it generates the cases. We built a process that looks at the flow, and basically it marries two paradigms of AI, machine learning and generative AI.
So now that we have this large repository of data, we're actually able to leverage it in order to look at more comprehensive outcomes. So we're able to look at not just our surgical events, but our patients who did not have adverse events. We're able to look at differences between those patients and really get a good idea of who is at risk for certain events in a way that we really weren't able to before. We're able to look at our protocols and our processes to see which patients could benefit from certain interventions, which patients don't necessarily need those interventions, and which patients could be candidates to go home earlier and sort of improve their quality of life.
The culture around AI and innovation at Mount Sinai is very strong, and we've been able to start getting our surgeons and researchers extremely excited about the potential use cases for AI and computer vision in the operating room.
It's the fusion of surgical techniques with imaging. That's really one of the areas where AI has been explosive. We could take images that are created on a CAT scanner or an MRI and fuse it together with images that we see in the operating room. And that technology allows us to be much more accurate, much more guided in our surgical interventions.
One of those tools that we're using in the operating room right now is called Eureka. It's very simple in principle, but it essentially is creating a visually striking appearance to contrast different types of tissues. What this can do in the operating room is it can actually improve the speed and the safety with which our experienced surgeons can operate. But even beyond that, it can actually accelerate the learning curves of our trainees, the surgeons of tomorrow, that can all of a sudden now sort of visually see the same things that the experienced surgeons can intuitively see, but took them maybe hundreds or thousands of operations to learn.
What vessel is that? Are you thinking the IMA?
This Eureka technology, I believe, will make a difference in next few years, especially in the arena of education. I believe being able to visualize the critical structures easier will also make our surgeries very safe. While training our residents and fellows will definitely improve the patient outcome. which is what we strive for.
One of the other companies that we're working with, called Surgical Safety Technologies, has a product called the OR Black Box. And for me as a surgeon, it's been absolutely amazing for us to be able to go and review and be able to refine our technique based upon how patients do during that surgery.
AI is really weaving together all of the different components of a surgical interaction in an effective way. AI is giving us enhanced vision, better ability to make a diagnosis, a better ability to plan an operation. Then when we get to the operating room, tools that provide guidance are allowing us to stay in the right place, make sure we do the perfect job.
You know, the global vision is in 5 to 10 years from now, sort of having all of these interconnected devices throughout our operating rooms, where the learnings that one surgeon is having from a challenging situation that they're facing and getting through can really be applied and transmitted to all the other surgeons across the globe.